Hello friends, welcome to you my channel Healthy Life. Polycystic ovary syndrome is a condition that affects a woman's hormone levels. Women with polycystic ovary syndrome produce higher than normal amount of male hormones. This hormones imbalance causes their body to skip menstrual period and makes it harder for them to get pregnant. Polycystic ovary syndrome is also causes hair growth on the face and body and baldness, and it can contribute to long-term health problems like diabetes and heart disease, birth control pills and diabetes drugs, which insulin resistance or polycystic ovary syndromes can help fix the hormone imbalance and improve the symptoms. Polycystic ovary syndrome is a problem with hormones that affects women during their childbearing years, that is ages 15 to 44. Between 2.2 and 26.7% of women in this age group have polycystic ovary syndromes. Many women have polycystic ovarian syndrome but don't know it. In one study, up to 70% of women with polycystic ovary syndrome hadn't been diagnosed. Polycystic ovary syndrome affects a women's ovaries, the reproductive organs that produce estrogen and progesterone, hormones that regulate the menstrual cycle. The ovaries also produce a small amount of male hormones called androgens. The ovaries release eggs to be fertilized by a male's sperm. The release of an egg each month is called ovulation. Follicle stimulating hormones that is FSH and luteinizing hormone that is LH, which are produced in the pituitary gland, control ovulation. Follicle stimulating hormone the ovary to produce a follicle, a sac that contains an egg, and then luteinizing hormone triggers the ovary to release a mature eggs. Polycystic ovary syndrome is a syndrome or group of symptoms that affects the ovaries and ovulation. Its three main features are cyst in the ovaries, high level of male hormones, irregular or skipped periods. In polycystic ovary syndrome, many small fluid-filled sacs grow inside the ovaries. The word polycystic means many cysts. These sacs are actually follicles, each one containing an immature egg. The eggs never mature enough to trigger ovulation. The lack of ovulation alerts levels of estrogen, progesterone, FSH and LH. Progesterone levels are lower than usual, while androgen levels are higher than usual. Extra male hormones disrupt the menstrual cycle, so women with polycystic ovary syndrome get fewer periods than usual. Polycystic ovary syndrome isn't a new condition. Italian physician Antonio Vallisneri first described its symptoms in the year of 1721. Pregnancy and polycystic ovary syndromes. Polycystic ovary syndromes interrupt the normal menstrual cycles and make it harder to get pregnant. Between 70 to 80% of women with polycystic ovary syndromes have fertility problems. This condition can also increase the risk for their pregnancy conditions. Women with polycystic ovary syndromes are twice as likely as women without the condition to deliver their baby prematurely. They are also at greater risk for miscarriage, higher blood pressure, and gestational diabetes. However, women with polycystic ovary syndrome can get pregnant using fertility treatments that improves ovulation. Losing weight and lowering blood sugar levels can improve your chances of having a healthy pregnancy. When to see a doctor? See your doctor if you have missed period and you are not pregnant. If you have symptoms of PCOS such as hair growth on your face and body, you haven't been trying to get pregnant for more than 12 months but haven't been successful. You have symptoms of diabetes such as excess thirst or hunger, blurred vision, or unexplained weight loss. If your periods are already irregular or absent and you are trying to get pregnant, do not wait 12 months to see a specialist to be evaluated. Also, keep in mind that if you do not wish to get pregnant, irregular or absent periods are not birth control in themselves. It may still be possible to get pregnant even under this condition. It's best to use contraception in this case even if you have PCOS. If you have PCOS, plan a regular visit with your primary care doctor. You will need regular tests to check for diabetes, high blood pressure, and other possible complications. If you are concerned about your PCOS and don't already have an endometriologist, you can view doctors in your area through the Healthline Find Care tool. Diet and lifestyle tips to treat polycystic ovary syndromes. Treatment for polycystic ovary syndromes usually starts with lifestyle changes like weight loss, diet, and exercise. Losing just 5 to 10% of your body weight can help regulate your menstrual cycle and improves polycystic ovary symptoms. Improves cholesterol levels, lower insulin, reduces heart disease and diabetes risks. Any diet that helps you lose weight can help your condition. However, some diets may have advantage over others. Studies comparing diets for PCOS have found that low carbohydrate diets are effective for both weight loss and lowering insulin levels. A low glycemic index diet that gets most carbohydrates from fruits, vegetables, and whole grains helps regulate the menstrual cycle better than a regular weight loss diet. A few studies have found that 30 minutes of moderate intensity exercise at least 3 days a week can help women with polycystic ovary syndromes lose weight. Losing weight with exercise also improves ovulation and insulin levels. Exercise is even more beneficial when combined with a healthy diet. Diet plus exercise helps you lose more weight than either intervention alone, and it lowers your risk for diabetes and heart disease. There is some evidence that acupuncture can help with improving polycystic ovary syndrome, but more research is needed. Let's know common medical treatments of polycystic ovary disease. Birth control pills and other medications can help regulate the menstrual cycle and treat polycystic ovary symptoms like hair growth and acne. Birth control. Taking progestin daily can restore a normal hormone balance, regulate ovulation, relieve symptoms like excess hair growth, protect against endometrial cancer. These hormones come in a pill, patch, or vaginal ring. Metformin. Metformin, that is glucophage fumarate, is a drug used to treat type 2 diabetes. It also treats PCOS by improving insulin levels. One study found that taking metformin while making changes to diet and exercise improves weight loss, lower blood sugar, and restore a normal menstrual cycle better than changes to diet and exercise alone. Clomiphene. Clomiphene, that is Clomid, is a fertility drug that can help women with PCOS get pregnant. It's important to note that as you are discussing family planning, to keep in mind that clomiphene increases the chances for twins and other multiple births. Hair removal medications. A few treatments can help get rid of unwanted hair or stop in form of growing. Eflornithine cream is a prescription drug that shows hair growth. Laser hair removal and electrolysis can get rid of unwanted hair on your face and body. Surgery. Surgery can be an option to improve fertility if other treatments don't work. Ovarian drilling is a procedure that makes tiny holes in the ovary with a laser or thin heated needles to restore normal ovulation. So friends, this is all about the polycystic ovary syndrome or polycystic ovary disease. If you like my video, then please like, share and subscribe my channel. And if you have any queries, then please ask me in the comment box. Again, I will come to you with another health related problem. Till then, have a nice time. Thank you so much.